conducting my practice in general adult psychiatry, I see a fair amount of substance abuse, substance misuse, as Kevin's colleague and my mentor, actually, Stu Gidlow, would be the first to tell you that we're not actually abusing the drug. The drug's okay, it's us that's getting hurt. So really misuse is often a term I prefer. And so I have 5 minutes to talk to you guys in response to much of what happened here in Kevin's presentation. So it is going to be kind of difficult, a bit like taking a drink of water from a fire hydrant. But where I would like to start is, first of all, considering I'd like to review a few of the things that were said that I absolutely agree with. And it might be surprising even to our speakers themselves about how much I would actually agree with them about a lot of what they have to say. So first of all, for Mr. Onifrey, you were talking about the trends in Mercer County and the increasing strength of THC and its effect on increasing addiction. And that is one thing I would actually say is true about the increasing strength of marijuana. And I think actually the statistics that Kevin Sebek gave you are probably accurate. As, you know, I didn't look too closely, but they looked about right as far as how the THC content of marijuana has been going up over the decades. But the question is, why has it been going up? And one answer that I would offer is alcohol prohibition provides a good analogy for this. During alcohol prohibition, first of all, I will be the first to tell you, again, because it's what I learned in my residency that I found to be quite surprising, is alcohol misuse, alcohol dependence went down significantly during prohibition. And we saw that those trends actually continued for a little while after the prohibition was over. But something else that we saw is that a lot of people went from using beer and wine, that's what they used to drink, they switched to hard alcohol. Why did they switch to hard alcohol? It's a lot more portable. If you're going to get caught with it, you might as well get caught with something worthwhile. And it's, if you're going to be buying it, you might as well get a lot of bang for your buck. And I think that actually explains a lot of what you're seeing in the trends around THC, because what you do see is in the states where marijuana is legal, you're seeing a much greater diversity in the strengths of it, which I regard as being a good thing, because if you do have a greater diversity of strengths, of course there are people who are going to go for the, you know, the earwax, and I mean that in the most descriptive sense possible that you were shown earlier. But for the most part, people are probably still sticking to the old-fashioned marijuana. And some other things to comment on. One is explosions that we're seeing with the concentrates. Yeah, I suppose there have been a few of them, thank you. I don't know where exactly they're happening and all of that, but I will say that the explosions are happening generally in illegal facilities, and if we were regulating facilities more, you might be seeing a difference in that. Hard drugs. Hard drug users, they generally do start with marijuana. They also start more frequently with alcohol, and of course, most of them start out being somewhat dependent on milk, at least for the first year or two of their lives. And we talked about the conditional discharge. That's a good thing. I agree with that, Mr. Onifrey. I am almost unable to read my cards. So if we get a little bit of that light back up, unless we're speaking anonymously, which I'm happy to do. Yeah, and you were wondering, is there, you know, first time only, first of all, the conditional discharge only applies for the first time. After that, you're kind of on your own. I'm not going to get into that too much. You know, the reason is that we agree that we don't want to punish the guy who is smoking a joint in the basement. The question is, how is that person going to get the joint, and what are we going to do to the person who sold that joint? And what if the person is getting a joint from a friend? What are we doing about that? I think those are questions that need to be answered when you're talking about the issue of decriminalization versus legalization. I'm going to skip ahead and talk about why not decriminalization, because that's actually one of the few points at which I would really disagree with what Dr. Sebek said. First of all, if marijuana was decriminalized rather than legalized, government can't regulate the product itself or its sale or its distribution. And something I've often said is that my kids are right now growing up in a state, New Jersey, in a nation where marijuana is not regulated by the government. I want my kids to grow up in a country where it is. I want my kids to grow up in a country where the points of access for marijuana are not on the street corner. They are not in the park. They are behind the counter where the cashier or the clerk is going to check for ID. Many of you may know that, marijuana dealers themselves do not ask for ID. They're happy to sell it to our kids. And so the point of access is always illegal when marijuana is illegal. I suggest that by making it legal for adults, we will hopefully be restricting the access for kids. And insofar as we wouldn't be restricting the access to kids, for decades, 80% of 18-year-olds have reported, and this is in some of the same studies that Dr. Svet was presenting, didn't make this point, but 80% of 18-year-old kids are reporting that marijuana is either fairly easy or very easy to obtain should they want it. So clearly, prohibition is not keeping it away from kids. You also saw a graph that showed how alcohol use is going down, and tobacco use is going down, and marijuana use is going up. I mean, it looks terrible, right? Which of those three are legal, and which of those is illegal? And when we see these kinds of trends, it's clear that prohibition doesn't work. And there's a researcher in DC named Sanho Tree, talks about this, he's a policy researcher and talks a lot about marijuana legalization. And he said something that I agree with, which is, I want to make marijuana boring. I want to make it unfashionable for kids to look at marijuana and say, I don't want them to be able to say, oh, that's, they're telling us it's bad for everybody. That's just BS. I don't believe it. And so we're going to, get some, we're going to sneak it, and we're going to use it. I want it so that when kids find out that marijuana is legal for adults and their parents are using it, it doesn't make it so cool anymore. It's kind of like when your mother is on Facebook. It's not really so cool to be on Facebook anymore, right? And I think that that by changing our laws and making it legal for adults and drawing a clear distinction between use by adults and by minors, then we're finally sending a consistent message about marijuana. When we try to tell kids that marijuana is really bad for everybody, I can tell you as a psychiatrist that is not true. It is actually problematic for folks who are predisposed to psychosis. You saw some of that data. I actually disagree with some of the conclusions made there. What we do know with some confidence, and I'm a psychiatrist who specializes in bipolar and psychotic disorders, is that if you're predisposed to getting psychosis, then smoking marijuana, ingesting marijuana in any form, actually does increase the risk of getting the disorder earlier. And if you already have it, you increase the risk of destabilization. I'm already out of time, right? No? I'm getting low. Okay, we'll wind it down. Of course, there's so much I could be saying about this, but one thing I'll say is that when it comes to predisposition to psychiatric disorders, marijuana is not our problem. Marijuana is the wrong drug to be talking about. When we talk about prescription drugs, seeing it all the time, my patients die from that. The folks who smoke marijuana, the adults who are smoking marijuana, they're kind of sitting on their butts. They're not necessarily doing much. You made the point that 25 to 50% of daily marijuana users are dependent on the drug. It sounds horrible. But I would also put it to you that maybe 99% of people who are drinking a fifth of Jack Daniels every day, they're probably also dependent on it. And that's a very high percentage. But basically that doesn't mean anything if what you're saying is that the people who use it a lot actually use it a lot. And I think what you're not hearing here is much balance in the argument about what is the actual danger to minors, to children, and to adolescents, which I think is very real, by the way. I think we probably pretty much agree on the data about that. What I strongly disagree with is the notion that by making it illegal for adults, we're somehow sending the right message to our young people by saying that, yeah, we understand this drug very well, and we know exactly what it's going to do to you, and that's why it's going to be illegal for everybody, because it's bad for everybody. They know it's not true. I'm just going to stop there. There's so much more, but I'm going to allow our next speaker to speak up.
Thank you, Dr. Nathan. Joel Palmalis will be speaking next. He's a person in long-term recovery from a substance use disorder. He's a true advocate with the mission of raising awareness and eliminating stigma that surrounds addiction and recovery. Joel was the chapter lead of Young People in Recovery, New Jersey for 2 terms, completing his 2nd term in November 2014. He's a board member of the Middlesex County Local Advisory Committee on Alcoholism and Drug Abuse, a member of the Coalition for Healthy Communities, a member of the East Brunswick Municipal Alliance, while also being an advocate leader with NCADD New Jersey. Joel is a full-time student pursuing a degree in psychology. Thank you, Joel, for being here.
I first want to say thank you to Barbara for inviting me out, and everybody who was involved in putting this together, and everybody who came out to learn a little bit or get a little bit more educated on such an issue that's such a hot topic right now in the community. Now, well, first, my name is Joel Palmalis. I'm an advocacy leader here in New Jersey with the National Council on Alcoholism and Drug Dependence, and I'm also a person in long-term recovery from a substance use disorder, more commonly known as addiction. For me, that means I haven't used alcohol or any other drug since July of 2011, almost 4 years now. Thank you. So I'm going to try and be quick. I usually, I can be long-winded myself, but I'm not a professional. I'm definitely far from a prosecutor. I'm not a doctor or anything like that, but I do have my personal experience, and that's what I'm going to share with you. How marijuana affected my life, how I became addicted, and where that addiction brought me, and in a quick snapshot. So, quick backstory. I'm from East Brunswick, New Jersey, in Middlesex County. Very, very affluent area, very well-endowed community. Addiction was not a big issue. I came from a nice family, and addiction wasn't something I thought I would have to deal with in my life. And I was kind of miseducated about addiction. I had an idea in my head that if I wasn't in an urban area, if I wasn't homeless, and if I wasn't using a particular substance, that I wouldn't have to worry about that could not become me. And that was far from the truth. I grew up as a kid saying I would never use drugs. I saw what that did to people, that's stupid, and I would never let that happen to me. I knew better. And by the age, I kind of hung out with punks. I was kind of like a class clown, and I always loved to get in trouble and stuff. I don't know why. Growing up, I always did the opposite what I was told. I don't know if that's just me, but the kids I hung out with, they started using at a young age. Once my friends in the early teens started smoking weed, I wanted to fit in. I didn't want to be rejected, and that was like a huge peer pressure thing. But I started getting high right along with them, and within a short amount of time, I usually go into a lot more with this stuff, but within a couple of years, I was completely consumed by addiction. For about 6 months, it went back and forth, and using a little bit and getting into the habit, and then I was getting high every day. And within a short amount of time after that, it was the only thing that was important to me. My family, my friends, sports. There was no more football. My education, none of that stuff was important to me. All I cared about, all I thought about was getting high, and that's what was important in my life. And by the time I was 16, I dropped out of high school. My parents kicked me out of the house. Well, I said they kicked me out, but they actually told me, either quit the BS or you can leave, and I made the choice to leave. And so at the age of 16, I was homeless, I was addicted, and I was a high school dropout. So we talk about like social consequences, right? Also living in East Brunswick, a very nice community, daily illegal activities taking place in the community, huge impact, right? So the relationship with my family and friends, teachers, my neighbors, everyone that I came in contact with, my thinking was completely clouded. I wasn't thinking clearly. You know, I lost the desire for a lot of things, and my ability for judgment and my decision-making abilities were sharply affected, vastly affected. And so my addiction progressed. Eventually, you know, after a number of years, it led to different substances. I wound up doing things I said I would never do. I wound up doing different drugs that I said I would never do, that I promised myself that I wouldn't do. Smoking marijuana daily kind of provided the platform of using a substance that I was told, you know, misinformation. You know, I saw that I didn't die the first time I smoked it and all this stuff. So I had the experience with using a substance regularly. And it wasn't, you know, I made it in my head that it wasn't that bad, and that provided, you know, the experience that led me into using other substances in the same way, and it led down a much, much worse road. But I want to touch on that I was both mentally and physically addicted to marijuana. There's a huge conversation that, you know, whatever. But I was absolutely mentally addicted. That came first, you know, the obsession that I had. Anything I did, I had to be high to do it. And, you know, eventually I was unable to face life without being under the influence. You know, dealing with feelings became very uncomfortable. And, you know, if I was going out or whatever the situation was, I wanted to be high doing it rather than not. But also the physical addiction. In my many attempts to quit on my own, the physical addiction was very apparent to me. It was, I hate to compare it to, I've been through opiate withdrawals and I've been through withdrawals from benzodiazepines, and it's like a very, very light withdrawal. It's not comparable in the extremity, but I absolutely had restlessness. My skin would be crawling at night. I was unable to sleep. I had extreme agita. And also my appetite, my ability to eat. I was physically not able to eat. I would get sick when I would try to eat if I was not under the influence. And, you know, so the topic or the issue of physical addiction, it's not even like a question to me. It's not even something I would talk about because it's my experience. It's what I went through. It's what happened to me. So it's not even, you know, that's just my experience. And so, let's see where I'm at here. I get a little scatterbrained sometimes. I got my notes here. So, long use. So in order to support my habit, I started selling marijuana. And from many years of doing that, I got arrested many times. I've been arrested 5 times, 3 times for distribution of marijuana as well. Now, this greatly affects my life and many opportunities that I would have, but especially in employment. You know, as soon as an organization or a company finds out that I have a drug conviction on my record, the window of opportunity closes very quickly. And that's something that follows me and haunts me to this day and will continue to follow me for many years. So one thing I wanted to touch on, I want to talk forever, I feel like I'm already over. It is what it is, like somebody throw something at me. So there's other great consequences that come from this. I think a lot of people forget that marijuana is illegal, other illegal activities harbor other illegal activities. When I was 18 years old, an individual made a decision to break into my home to rob me. He knew that I had marijuana in the house. He was in a hard financial situation of his own, and he made that decision. So on August 8th, 2003, a Friday morning at 5 o'clock, this individual broke into my home. During this home invasion, I was robbed. I was stabbed 7 times. I was stabbed twice in the neck, the back, the chest, the arm, all over. And I wound up in the hospital for about a week. A collapsed lung, 47 staples all over my body, and you know, collateral damage, right? So everybody in my family was there. My brothers, my mom, you know, she got it the worst, of course. And you know, it's something I'll have to live with forever. You know, I will never be able to forget that. I can't change that. I can't change that my family had to go through that experience. And you know, sometimes we forget that stuff. You know, we don't think about everything that could come with drugs. You know, it's because it's not that bad, or it's not crack or heroin or cocaine or something like that. You know, and it's just misconceptions. You know, some people might see that as something that you know, if it was legalized, that stuff wouldn't happen. You know, it's very important to be fully aware that. There will always be like a thriving underground market in the community, especially in communities where there's an open market or free market for a substance. It's blatantly obvious. And, you know, I was always the one that said that would never be me. You know, I would never let that happen. I'm smarter than that. You know, that's what happened. You know, that's my story, and I know it and I lived it. You know, it's important for me to share it, to maybe help shatter some myths surrounding this issue, like marijuana is harmless and marijuana is not addictive. I don't share this as scare tactics, you know what I mean? I'm just sharing my personal experience. This isn't what's going to definitely happen to somebody if they smoke weed or if they continue to or anything like that. It's just been my experience, so it's important for me to share it, to shed the light on some things that are unknown or might not be thought about when evaluating the dangers of marijuana. Now, I don't want to leave you with that picture. I do want to let you know that I was able to receive treatment for my addiction and then enter into long-term recovery. I've been able to change my life and rebuild it. I'm currently gainfully employed with a great organization. I'm a full-time college student pursuing a degree in psychology. I'm a constituent in the state of New Jersey. I vote, I pay my taxes, and I'm heavily involved in volunteer work in the community with many different organizations. Most importantly, I'm back in my family's lives. I've learned how to be a son, a brother, an uncle, a nephew, things that were taken away from me due to addiction. I've dedicated my life to helping others and being of service in any way that I can. So there is hope after addiction. It's important to know that. And you know, I'm also afforded great opportunities to share my story and possibly help someone and share the microphone with amazing individuals who are making such great, impact on society. So with that, thank you for listening.
For your story. If there are any people that have 3x5 cards with questions on them, if you could just make sure a staff member gives them to me. I do have a few up here, so we have a few minutes for questions, and I wanted to, some of them are for specific panelists. Joel, this one's for you. Based on today's conversation, what advice would you give, first of all, to parents, and also what advice would you give to young people here today?
Oh man, it's tough. What advice would I give to parents? Make sure that you are involved with your kids' lives. I guess, especially some focusing on the youth. If you're worried about your kid doing something or falling into addiction, nobody knows your kid better than you. If it seems like something's up and it smells like something's up, something's up. It's very important to address these issues head on. So a lot of people are very quick to avoid that awkward, uncomfortable conversation because it's easy to do that. Mind you that addiction is a preventable disease. If this stuff is caught early, it doesn't have to go down the stuff that I just talked about. So parents, it's very important to be involved in your kid's life, to watch out for warning signs, to notice changes in extracurricular activities or the circle of friends that they're hanging out with. Very important stuff. And for the kids, I'm not going to hit you with the Reagan hit, just say no, but just be mindful, be educated. Know that you need to educate yourself. You need to have information. You need to know that this stuff is possible. And I mean, I am one to say that just don't do it, don't get involved. Why do you need to do something to enjoy yourself? Why do you have to put something inside of you to feel better, to have more fun? It just doesn't make sense to me. Maybe there's some other stuff going on that needs to be addressed. But yeah. Yes,
okay. Thank you.
Yes.
Dropping all my questions here. Thank you very much. Okay. Another question here we have. If each panel member would just take a moment to chat about the racial implications of the criminalization of marijuana users. Anybody want to start?
Sure. It's interesting. I was actually, when I was putting together my little speech, I was seeing if I should throw in some facts, and I know the individuals up here a little bit just through, not personally, but I knew I didn't need to come with facts and stuff. But in my reading, I actually read that for I guess like in urban areas, people that are African American are 2 times more likely to purchase marijuana outdoors, and then 3 times as likely to purchase marijuana from people they don't know, putting them at much higher risk to either be arrested, caught by police, be out in the open with their drugs. And what was I forget what the other part I had was, but yeah, I guess that's it. Good. I don't mind.
As a law enforcement agency, we're always concerned with with any racial implications about who we arrest and things along those lines. But the reality is that we kind of look at it from a little different perspective, in that what resources are available to those that are addicted in the end. And through the drug, and Dr. Zabet mentioned the drug court programs, and Dr. Nathan alluded to it, they are very successful and they're open to everyone. I read a recent statistic that, and I know I said I hate statistics, but a recent one indicated that the success rates at Betty Ford Clinic and places like that are about 25%. The success rates through the drug court program here in Mercer County are about 64%, and they are available to everyone. So I think there is a disparity in the availability of treatment to those folks who do get arrested and who do want to quit. But the drug court program really is trying to close that gap.
Thank you.
We're going in line, so I'll go next. And the statistics that we use in New Jersey United for Marijuana Reform is based, probably not surprisingly, on the ACLU's research. ACLU is one of the two major coalition partners, the other being the NAACP. Why is the NAACP now on board with this issue? I know Dr. Zabet has said in other contexts that a lot of the black churches are opposed to legalization. I think that that's probably changing. In fact, one of our endorsers in New Jersey now is indeed a black clergyman from the Newark area. And we have a number of folks who actually support us. Why is that? It's because in New Jersey, blacks are nearly 300% more likely to be arrested for marijuana than whites, despite similar usage rates. And we talk about poor neighborhoods, and you know, the legalization would obviously create a much greater burden for them. Let's think about why it is that some of these neighborhoods are poor, why it is that the fathers aren't there, why it is that such a high percentage of African Americans are in prison, and there are more African American men of college age in prison instead of in college. Why is all of that true? And what can we do about it? Decriminalization? Well, so look at Colorado. Colorado has legalized marijuana, and the ratio of arrests between black folks and white folks actually hasn't changed. The numbers have gone almost away, obviously, because now it's legal. But when you look at what people are being arrested for, it's still the same percentage. It's still much higher arrest rates for blacks than whites. One other comment I wanted to make about drug courts is that while they do afford the opportunity for folks to get treatment, and for those who need it, and I think Joel has really, you know, made the case for how it is that marijuana really can wreck somebody's life, particularly as Dr. Zabet was saying, when you start in childhood. And that's really it. I think you really hit the nail on the head when you said that if you don't get addicted to cigarettes or alcohol or marijuana before you reach your age of majority, you're very unlikely to then have a problem with it. That, by the way, is also one of my major reasons for wanting to separate those two groups when you talk about the legality of marijuana. But what about somebody who gets arrested for a joint or is somehow caught with marijuana, and you know, let's say that somehow they are being prosecuted. They get recommended for treatment, and this has happened to a lot of my patients, by the way, who don't really have substance use problems. That's not their issue. But they got caught with a joint. What happens? They go into treatment. And folks who are opposed to legalization will tell you that, that the highest number of people who are being arrested, who are being given treatment for drug abuse, it's for marijuana, illicit drug abuse. They'll qualify that. Because obviously alcohol is legal, and that's of course more common. But most people are being treated for marijuana. Why is that? Because a lot of the treatment is court mandated. And I would suggest that a lot of the people being treated really don't need treatment. And again, we want to try to define the scope of the problem properly and not cast such a wide net over the people who are considered to be dysfunctional from the drug, and also to lump adults in with kids.
Well, David, you made a couple of my points. I don't know on purpose or inadvertently, but yeah, thank you. Yeah, alcohol more common because it's legal in the treatment system, absolutely. And the other part that in Colorado, even where marijuana is legal, and this gets to the crux of the question that was asked about racial disparity, there's still a disparity. There's still the same ratio as prior to legalization. And I think what that says is probably what everybody knows, which is the idea that we can undo the racial elements in the criminal justice system by legalizing marijuana, I think is frankly a little offensive to the civil rights movement, actually. Because the core issues that we're talking about, if there is the racism that's going on in the criminal justice system, the idea that by legalizing marijuana, those things can be solved, that there will not be 27 other reasons to arrest somebody of color, to me is surprising, and that's why the national NAACP has not endorsed legalization, although I know the chapter in New Jersey and also in California has. And so when you actually do look at, and I you know, understand about some of the supporters, but when you do look at some of the ratio of people who support legalization versus do not, the average supporter is an upper class liberal white male, which is, by the way, the average person who's out there on Capitol Hill lobbying for this. It's when you look at Latinos, when you look at African Americans, believe it or not, although those arrest statistics are true, the support in terms of percentages is certainly not as high as that. So what I would say is, I also agree with you, David, on the idea of you don't want to cast such a wide net. And that's why I don't think that every person arrested for marijuana, if you have a joint, should go to treatment. So we need to have a proper assessment to see what's going on, to see if treatment is needed or not, by folks like you, who are professionals, to make the decision, not just a law on the books, whether or not that person needs treatment. And that's something I stand wholeheartedly support. But those things can be fixed. I mean, that is not fixable, right? And I understand, you know, although the county prosecutors have come out against legalization, and the municipal prosecutors are part of the alliance with you, David. And I think part of that is, I understand the frustration they had that we actually heard earlier, right? I mean, there's frustration with some of these low-level offenses. Let's fix it. I mean, let's change the provisional so it's not just the first time that you get treatment. Let's change it so there's a proper assessment, not just referral to treatment. And let's change it so that it's not in necessarily the criminal system, which is where we heard we heard so eloquently about some of the negative ramifications of having a criminal record. Let's fix those things, right? Without, and I'll finish here, sort of this idea of when you said, let's make it boring, right? Let's make marijuana abuse boring, which I totally agree with. That's not happening when you have, you know, Chiba Chews and gummy bears and fluorescent colored lollipops. That is what legalization is in somewhere like Colorado. When you have the free dab on the freeway, you have the advertising. I would love to make it boring. And if we can do that, whether it's illegal or legal, let's figure out how to do it. Certainly in Colorado and where this is moving, where the real political, financial momentum is right now to legalize, it is not in the camp to make it boring. It's in the opposite camp, to make it as attractive and as cheap, frankly, because they want to bring the taxes down now so that more people can buy it so they can make more money, not the government, and make it as kind of commercialized as possible.
Can I respond to that?
Sure.
Yeah, a couple of points. So, saying that calling for the legalization of marijuana as being at least a partial solution to the inequities over racial arrests, saying that that's offensive to that community. First of all, I think we should ask them what is offensive to them, and I don't think we want to risk condescending to say what it is that they want. Certainly in the state of New Jersey, the NAACP wants legalization. And even if you still have the same ratio of arrests, if those number of arrests are going down,
But public arrests are going down.
What's that?
But other arrest categories have gone up in Colorado, like public arrests, which never happened.
Yeah, and you know what, there are statistics that support that, you know, Colorado's going to hell in a handbasket, right? There are, anybody been to Colorado lately? It's not that bad out there. Things are not going that poorly. Their driver fatality rate is down, even though you will hear that the number of people testing positive for marijuana is up. And certainly, by legalizing a drug, you may very well see an uptick in usage. I don't think that that's so surprising, especially when that drug has been illegal for 78 years for reasons that at least initially we agree that they were terrible reasons why they made that drug illegal. And I don't know if you guys realize that the American Medical Association opposed prohibition in 1937. They sent one of their best physician attorneys, who is one of the world's experts on public health, to go to Congress once they found out that the hearings were being held to ban this substance called marijuana. Doctors didn't know what marijuana was because they knew about this drug cannabis that had some uses, and frankly, it wasn't considered the greatest drug in the world. And as a psychiatrist, I'll tell you, I still don't think it's the greatest drug in the world when it comes to medicinal uses. At the same time, they were still using it here and there. They had no idea what marijuana was. Why? Because it was being pushed through as a political issue, not really a health issue. Because the folks who wanted to get it through without the AMA even knowing about it. And there's a bit of an analogy in this case, because I don't know that if you know that this panel originally was not going to include me. I actually had called up and asked if I could participate. So I do thank you for that. But I should note that when we talk about a conversation about marijuana, that conversation certainly needs to have some balance. And I wonder what this would be like if I was not here, facing a fairly formidable panel. So a second idea is that psychiatrists should decide, if somebody gets caught with marijuana, doctors should decide whether that person should get treatment. Is that really what we want our physicians to be doing, is deciding whether somebody who got caught with a joint needs to be treated for marijuana dependence, when marijuana is not nearly the drug that even alcohol is? And I would put it to everybody here that, to me, the only morally consistent argument, the only logically consistent argument, is either to make marijuana legal for adults, or to make alcohol illegal for adults, to make tobacco legal for adults. Why don't we do that? We talked about cultural history. First of all, I happen to know, because I'm a bit of a geek on history, that the cannabis was cultivated in prehistory. It was cultivated in antiquity, which is why that plant that produces hemp, is the fiber, actually the amount of THC has been going up for many thousands of years. We're just much better at manipulating it now. So I don't think that it's really the best use of my time or other physicians to be deciding if the average adult needs treatment. If a kid is caught with a joint, that's a totally different matter. That kid needs help. That kid needs to be somehow persuaded otherwise about their use. Much more I can say, but I want to continue.
We're running a little late here, but I do want to thank all of our panelists for their perceptive and their I hope you have more pieces to the puzzle now and making your own decision about the topic of marijuana.